right now we're gonna test the ligaments of the knee. Our patient was nice enough to get their leg out of the way so that we can see. That's not very comfortable with the patient. Typically we would not have them like this. The first one we're gonna do is the interior drawer of the knee. You can come and stabilize the foot by sitting on it. And then you want them to relax their hamstring. And then what you're gonna do is find the tibial plateau, have your thumbs on them, and then you're gonna try to test the integrity of the ACL by having, you can do it slowly first, but then you wanna give it a lot of force to see if you're gonna create an interior drawer, which if it was unstable, what you would see is the tibia moving forward abnormally in relation to the femur. Our patient has a fully intact ACL, so we won't see anything. Then we can do the opposite of trying to push forward to see if there's a PCL issue. Again, no issue with our patient. And then we're gonna do a Valgus test that tests the MCL that can be found on the internal side of the knee. We do it just below 0 degree of extension, so maybe a 2-3 degrees of flexion. And what you do is you press against the knee towards the inside to see if you're gonna have a gapping of the tibial plateau here. What you would see is you would be able to go abnormally too far, or you would create pain. So we do it at almost 0 degree and at 30 degrees to see if there's an issue here. Then I'm gonna move to the other side just to show you because it's easier. And we're gonna test the LCL. And we're gonna do the varus test. So at this point, you put your hand on the inside of the knee and you press to try to bring them into a varus position. Do that again at 0 and at about 30 degrees of flexion. So the interior drawer is not that specific, is not that good for the ACL. Sometimes you might not feel it that way if it's not a complete rupture or if there's some muscles that are compensating. So what you can do is a Lockman, where you want them to have a 30 degrees of flexion, and then you do an interior drawer in that position. The problem with that is if you're small like me and you're testing a player that is that much bigger than you, you cannot have as much strength to do this. And that's why you can do a prone Lockman that I'm going to show you in the next video.